The following segment is sponsored by University of Utah Health. Around 2.1 million Americans are living with limb loss, and that number is expected to double by the year 2050. In honor of Limb Loss Awareness Month in April, Dr. Spencer Thompson is here to share how those who have lost a part of their body can seek help and support. Doctor, thank you so much for coming on the show.
Thank you for having me. I'm honored to be here.
Of course. So what is the common cause of limb loss?
The most common cause out there is people who have diabetes. They have poor wound healing from the diabetes, and so if they get an infection or a wound that doesn't heal and it's not taken care of, that can lead to them losing their limb, or vascular issues, blood clots. And other common cause is trauma.
Yeah. I mean, no matter how it happens, it's so devastating for these patients. So what kind of patients do you work with at the Nielsen Rehabilitation Hospital?
So we work with all patients with limb loss. Majority, I would say, are those with diabetes, but also a lot who have trauma. So the Nielsen Rehab offers an inpatient rehab unit where they will go if they need some help to get home after their amputation. And then I work in the outpatient setting at the Sugar House Health Center. And my job really is to help train patients when they get their prosthetic to start to regain that functionality and start to learn to walk and live with their limb. And so we offer both inpatient rehab, outpatient, and we also have an amputee clinic that is it's every Tuesday afternoon. It's with a multidisciplinary clinic where there's a physician. I'm there as the physical therapist, and then multiple prosthetists are there to provide a multidisciplinary approach to help them achieve their highest functionality.
And let's talk about that a little more. Do you help with prosthetic limb fittings?
No, so we at the U do not have like a in-house prosthetist. We work with many local vendors around the valley, and we help patients, guide them in their choice, but we do not have that, but we are providing recommendations about what type of limb, what type of knee, what type of foot we think would best benefit this patient, but we do not do the actual fittings
But
in-house.
you are there giving them advice and helping, along the way.
Yeah, we help provide support and the advice and really the training that is needed to help, because there's so many complications that come along with losing a limb besides just having a part of their body missing, and so we help provide support for all of that.
And let's talk a little bit more about that. Can you talk to us about the realities of living with a limb loss?
Absolutely. I think when people, a lay person, to see somebody on the street without a limb, they may think, oh, that's interesting. I wonder how that happened, and that's probably hard. And I don't think people realize the realities of living without a limb. They have skin issues. They're putting something on their body that sometimes feels good, sometimes doesn't. You have to think about, they have to put something on in the middle of the night to go to the bathroom. You can't just get up and move. It's a lot harder to learn to walk and to live again, actually. And so when you do see somebody on the street with an amputation, just go up to them and say, you're amazing, way to go. I think you're awesome for making life work with this, and just honor them for the way that they're living, because it's not easy.
Yeah, Doctor, you are doing amazing work, and you are literally changing lives. Thank you so much for being with us today. And for more information, you can visit the website at the bottom of the screen. Again, thank you for being with us,
Yeah,
Doctor.
thank you for having me. I appreciate it.